Hi, it's Kristen here at UT Southwestern Medical Center. Thank you for joining us for our Facebook Live. Today we're going to be discussing this partnership we have with Paul Quinn College here in the Dallas area. I'm happy to welcome Professor of Psychiatry Timothy Wolf, who's going to be joining us, as well as Psychiatry Fellow Jessica Moore, who leads the mental health program at Paul Quinn. So I want to thank you both for joining us. You know, we've got a couple things, just a couple reminders that we always go over. Don't forget to like and share the conversation. We want a bunch of people to know about this great partnership we have, as well as leave your comments in the questions section. So in your comments field on the live, we will answer as many as we can get to in the 30 minutes. And we also want to thank a bunch of different partners for helping us promote this chat. I think we have the School of Health Professions, the Graduate School of Biomedical Science, and the Clements University Hospital team. So thank you all for helping promote this. So in the meantime, we're going to go ahead and get started. So tell us, so I know Jessica, you were involved in really starting this program. So tell us a little bit about the partnership and how it originated.
So President Sorrell is the president of Paul Quinn College, reached out to the psychiatry department and Dr. Dominga to really kind of assess the needs of his students.
Okay.
He noticed a lot of maybe mental health challenges. Some of the students come from backgrounds with trauma and noticed that they might be having some mental health needs, and so really reached out and said, what can we do to address some of these problems?
Okay.
So kind of that's how the partnership started.
And when was that?
It was in 2014.
Okay. So now with Dr. Wolf, I know you've been a psychiatry professor for a while. What are some common issues that occur with, somebody that's going into college? What are some common problems?
Well, so just in general for college, it's a great transition time for people. It's kind of an introduction into early adulthood, and there are plenty of challenges involved with it. There are more freedoms and opportunities for students to do things, explore things, etc. So it's so we realize that there's an exciting part to it, and there's an increased responsibility part to it, and then there are challenges whenever someone has to deal with a change like that. There's stress involved with it as well.
Right. So since this program has been in existence and looks like we're starting to get some in, what are the characteristics of the students that you see in the clinics, kind of in general terms? Are they younger students? Are they older students? Is it a mix?
Yeah, so I think we see students in the clinic from kind of all walks of life, from all years of college, so freshmen through seniors. We see students for anything from like depression and anxiety to students that might have had problems with substance use and everything kind of in between.
Okay, so it really does run the gamut.
Yeah.
Okay, good to know. So I know we've got a couple things that are starting to come, but we've got one that came in ahead of time. They were wondering, you're talking about college students. And Paul Quinn is a historically black university. Are there any cultural issues that they might be dealing with that a student at another university might be facing? And whoever wants to deal with that.
Well, for sure there are some differences. A lot of things, as I mentioned, are the same type of things that are challenges for students. I think that there are, when students, many of them come from disadvantaged backgrounds, and so that there are issues that come up about trauma that they may have had during childhood that others may have had, but not maybe to the degree or numbers that we're seeing at the Paul Quinn students.
Okay.
There's issues about discrimination that they've had to deal with, and I think it's even a challenge for us when the non-African American mental health professionals trying to relate and talk to them in a way that they don't feel like it's difficult or too difficult to be understood.
Gotcha. That's a good point. So I want to jump to some of the questions we're starting to get now that we've started. So we have one here from Lori, and maybe you could take this, Dr. Moore. She says, how do you know if you are simply sad or worried, or if you really need to seek help and make that call?
Yeah. So I think that everybody, especially in college, like Dr. Wolf was saying, experiences stress at some point in life. Yeah. And really what I kind of think about is when do I need to seek help? Is it impairing my functioning? So am I really struggling to go to class? Am I really struggling to get that presentation or my homework done or make it to work on time? And when people are having some impairment in their functioning or even kind of on the edge of getting impaired and being able to kind of meet their goals that they want in life, that's when I think it's time to get help and seek help.
Okay, and what are some options for help? I mean, is it something where you should call a center, such as, or go to a program, or are there other resources people could try?
So I think one of the things that we really ask people to do is kind of first, if you need some support in doing that, like talking to a friend and getting some support in that. So it could look anything like reaching out to your primary care physician and getting help from them, and then getting a referral to see a psychiatrist or a therapist from that point, but really kind of gathering all your support that you have in your community and from that area.
Well, great. So thank you for the question, Lori. It was a great one to start us off. Keep submitting them. I want to get back to the Paul Quinn program for a minute. We've started this program there. Do you think that this would be beneficial at other colleges, something like this? I mean, I assume that many of them already have them in existence, or am I completely off the mark?
No, many colleges have like student mental health services or student wellness and counseling. And so, and here at UT Southwestern, we have one as well that I've been working at for about 29 years now, part-time. So I think that most is pretty recognized now in the collegiate environment across the United States that there's definitely some students with problems, including substance abuse, et cetera, or anxiety or adjustment. And so that many of the schools now have a facility or a place to go. Certainly University of Texas has it, and many of the other schools in Texas have it. The smaller schools are more challenged because of limited resources to be able to do something like that. But again, when the UT Southwestern and Paul Quinn are kind of matched up together to be able to get at least kind of an island of help, if you will, to be able to do it. And unfortunately, we're not able to do it all week long, but able to have a place for students to come if they have needs.
So that brings up a point. I mean, how do they interact with you? Is it a clinic there on campus that they can go to a couple times a week? Are there the same psychiatrists and staff that are there, so they're the same faces? What does it look like?
So I think that's a really cool part about this partnership at Paul Quinn is that it's really collaborative. And so part of the programming is through a clinic that is staffed by Dr. Wolf, and then it's a resident opportunity. So psychiatry residents can rotate there as an elective during their time. And then I think the other really cool part is that there's programming that does like outreach and kind of student engagement portion. So kind of teaching not just people that might visit the clinic, but teaching the whole student body about mental health and mental wellness and how to be well in college at a really challenging time.
Wow, that sounds amazing. Yeah. So we have a comment here from Liza related to something we talked about, and thank you for the comment, Liza. She says, thank you for bringing up the potential cultural differences between students and mental health providers. I think that aspect is so important and often overlooked. Do you agree with that, Dr. Wolf?
Yes, I think it's very challenging. And just in general, because of, number one, stigma about coming in, but number two, about feeling like somebody can be able to understand for their particular background. Now, I think there's a bias against, but psychiatrists in general are trained to not have biases as best as we can, and to be able to try to understand people from where their situation is. But I do acknowledge that there are things like words like chill, for example, that have had to become kind of initiated on the different nuances of a word like that to be able to understand a little bit better. I do think that that the students do relate well, especially better if someone's similar type cultural background or African American, for example. I think Jessica did a great job as far as relating to the students there, and I think that put them at ease a little bit more. Yeah.
And I was going to say, I think that's really an important part of like training for all physicians is we hear this word like cultural competency a lot, but really trying to figure out kind of where biases might lie, where areas of how I can relate to this person and connect whoever is sitting in front of me, whether they're a similar background or not background as me.
Gotcha. So we've got another question in, and this one deals with a similar topic. It's why is it that fewer African Americans seek mental health care compared to a larger number of other groups? Is it the stigma associated with it, or is there another reason that we're not considering?
I think it's complicated.
Yeah.
That there's certainly stigma. I think there's access to resources, and that's another really cool thing about this partnership at Paul Quinn. It fills this gap where there isn't a limited amount of resources in that community. I think there is some just exposure to, if I've never seen a psychiatrist before and I don't know what a psychiatrist looks like, and
it can be scary.
Yeah, it's really kind of
scary
scary
for anybody.
to sit in an office. So
yeah. All right. Well, really great question. Thank you for submitting it. So I'm curious, that you said when we started that, President Storell contacted the psychiatry program. What made you both want to be involved in this particular adventure? I mean, it's such an amazing opportunity, both for UT Southwestern and for Paul Quinn. Were there certain things that really caused you both to want to be involved?
There's an element of I think in the community of wanting to do something positive, and especially like for South Dallas, that area has been somewhat neglected, I think, overall, from a Metroplex standpoint. And I think it makes me feel good that we have something that we're doing and investing in to help out for both the students, but also just the community as well.
What about you, Dr. Moore?
So my mom is a college administrator, so I grew up on a college campus.
Okay.
And then, so I did not attend an HBCU, but I think that a lot of people in my family did, and just being around kind of that cultural aspect of like what it's like to be at an HBCU and be able to kind of know that there are mental health needs on that really got me excited, and just hearing the stories of the students at Paul Quinn are so wonderful.
Yeah, it's an amazing campus. I've been able to visit there a couple times, and I'm always very impressed by what's going on. So do you, so at this clinic where students come, what types of therapies? Do you offer group therapy, private therapy? Is it a combination of the above?
So right now, what we're doing, the clinic runs on Thursday mornings, and so patients, students come in, they're patients, and they get evaluations done, and they're getting individual therapy and medication as well. We're interested in having groups. We haven't quite evolved there yet, but that one of the things that we think that would be helpful to do. One of the challenges, and again, this happens whenever your student health situation, is that they have their own the curriculum and their schedule.
Right.
And so that we've tried, actually Dr. Moore helped kind of navigate us to a day when we thought that it would be more likely that students could come. And that's been true, but it's still a challenge because also Paul Quinn has a work program. So if the students are not going to classes, they're frequently going to work, and so they have to get an excuse from work. So we're right now that's what we're doing. We're looking at different ways and expanding if possible as well.
That's good. So we've got a couple comments here. So one of them is from Veronica. She says, "How wonderful that the community can really get knowledge about the health needs of today." So thank you for that. And then we've got one from Eric, and this is a different question. He says, "Why aren't there more NAMI groups available on college campuses such as Paul Quinn? There's oftentimes a stigma associated with mental illness, and group acknowledgement helps." It sounds like you're working toward at some point possibly offering that group session, but it's more about resources at this point.
Yeah,
Do you want to respond to that?
Yeah, I think trying to figure out kind of what are the needs of the students and how we can best address those, and kind of getting student buy-in to that part. And so some of that might be group work, and some of it might be working out individually. And then there's also campus-wide interventions that we can do.
So thank you for that comment and that question, Eric. That makes sense. So we've got what about, this was it's been a while, I'm going to tell you, from when I was in college, but what about, are you able to offer services and talk about suicide prevention? Are there hotlines available? Do you even venture into that area?
Yeah, so I think that's a really good question. I don't know if you want to take that first, Dr. Wolf.
Well, the thing is that we are working on that, but that still is obviously a very important issue and problem. Because we're not there all the time, it's that the deans and the advisors, etc., have to be aware of what to do in circumstances when we're not on campus, including to be able to help someone understand or help get the help that they need.
And I was going to say, I think a really important part of our partnership is that helping the faculty and not just the students be educated on like what is a mental health crisis, how can I access resources if I'm in a crisis, and teaching them so they can also teach and intervene with students when necessary.
That actually is what somebody else asked as a follow-up question. They're wondering, you know, how can other people help? You know, if they're not on faculty at Paul Quinn, they're not a student there, maybe they're not even affiliated with us. Are there things that they can do to help with this program or to help with mental health care in general? That's
Excellent
a very
question.
It's a very tough question.
Well, I'm sure
love that.
if President Sorrell were here, he would say, yes, please donate to the institution.
Yes,
and I think
the
that,
enthusiasm.
and I think that there are, I actually think there are quite a few people, philanthropists in general in the community who have actually already given money to the institution and are helping out. And so, and I think President Sorrell and Dr. Grant, one of the vice presidents there, have done a very good job about being able to raise monies to help for the facilities and also the services.
Right.
So the question may also be about, can there be volunteer work that someone does? And right now, we're not as sophisticated as a point to do that. But I would say that general support for the institutions, both Paul Quinn and UT Southwestern, are very much appreciated.
Yes.
Yeah.
And I think spreading the word about our program. So in kind of exactly that vein, the more that people know about this program and this partnership, and so sharing this video on Facebook and asking people and telling people about kind of, hey, what are your mental health needs, kind of reduces stigma and lets people know about kind of what's going on at Paul Quinn.
Awesome. Well, thank you. So let's see. We've got a question from Italia, and she's wondering about more of process. She says, do you try therapy first before going down the medication route? It seems like, of course, you're going to try everything, but she's wondering how you handle that.
So it's so it's kind of a philosophical question about it. That in general, we want to do things that are in the best interest of the patient at the time. And so I would say, it's well over 50% are not getting medications who are coming in to see us, and they're getting actually talk therapy.
That actually was another question we got that I don't. Who asked that? I apologize for not finding the name. They just flat out asked, does talk therapy work? I mean, is that effective for some people where they don't need to go down to medications or group therapy? That just sitting down and talking with somebody can really help them sort out whatever it is they're dealing with.
Yeah, I think absolutely that we know that therapy for some people works really well, and then sometimes for people medications, and really the combination of that can be really effective for some people. And being able to get therapy for somebody that's really trained and can kind of address issues that it takes some time and some investment with people and kind of repeatedly going over and over, but it really can be effective for a lot of people.
Okay, so great question. I'm sorry I don't remember your name. So that was one that came through, and so we have about 15 minutes left, guys, so I want to keep those questions coming. We've had some great ones so far. Please keep submitting them. Don't forget to put them in the comments section. And also, please continue sharing this chat. We're getting some more views, and it's a great conversation about a really important program. So related to talk therapy, what about, somebody mentioned this, what about like holistic type therapies? Do you recommend that as part of a comprehensive treatment plan, or maybe somebody you need to try yoga or this will help you? Is that into consideration with students particularly?
Well, I wouldn't say that we're doing holistic therapy at the clinic. However, when we're doing evaluations and treatment plans, it's not just for the therapy or say medications. It's actually looking at more comprehensively about what things are available to them both on campus and ways of looking at things. So it's like taking good care of their health, eating well, sleeping well, getting involved in possible support networks on campus and activities. And so we're trying to familiarize ourselves with what's available and making sure that the students know these things are possible. Now, as far as yoga and exercise, we know that helps for depression and in general well-being. And so we're thinking broadly to try to help the students.
Okay. So let's see. Eric came back with another comment. He said cognitive behavior therapy has been proven successful in many cases per research. It sounds like that's what you guys are doing.
Absolutely. So cognitive behavioral therapy is an indication in depression. There's also kind of other forms of psychotherapy, like psychodynamic therapy, that are also really effective. Cognitive behavioral therapy, or CBT,
is exactly what you're doing. So what do you guys know? What do you think about, somebody, you have the students that are seeing you. What about the students who maybe have a friend that they're concerned about? What should they do? Should they come and talk to you about how they're feeling about their friend? Should they talk to their friend? I mean, what are some recommendations you have?
That's a really good question. So I think one of the things that we really ask people to do is be supportive. And so that's one of the reasons that we do outreach on this campus, because it might not be you that's in this scenario when you're really struggling with depression or anxiety or adjusting to college, but you might know a friend. And so one of the things that we have sometimes even people like practice and role play with each other is like, if I have a friend I'm concerned about suicide or one of those things, how can I walk them down to clinic? You might not be able to stay for their visit, but I can make sure they get to their appointment. I can remind them of their appointment. I can be supportive and non-judgmental about some of those things. And I think that's really how, if you're concerned about somebody, saying something, because that's how people feel supported.
It could be really hard, though.
Yeah.
It could be really hard.
And that's why we have people practice, and we try to reach the whole campus with that, and not just the people that maybe are coming to clinic.
Got you. It looked like you wanted to add something.
Well, yeah, so there are advisors in the dorms, but also the deans are well aware of our services and are interacting with us. And so that if a student felt like their fellow student was having problems and they couldn't motivate them to come in for care, they can also talk to the deans about trying to get them to get the help that they need. So I think the deans we're working with them to talk about services and about the ways about thinking psychologically. They're themselves very sophisticated in knowing about it. And they're also very culturally in tune and good motivators also.
Right.
Yeah.
It sounds like a really good partnership there. So we've got a question from Italia, and this is an interesting one. She says, do you think it would be more beneficial to implement something in the college curriculum for freshmen to take a class that teaches them about how to handle stress and depression? I mean, that is a really interesting idea. I don't know if colleges are already doing that. What do you think?
I think lots of colleges are doing that. One of the things that we do, so Paul Quinn has a program called Summer Bridge for all incoming freshmen or transfer students. So we try to be a part of that. So during their Summer Bridge program, we do kind of a mental health 101. We've done it over the last 2 years during Summer Bridge. And just to kind of introduce the idea of mental health and to give them information about the resources available on campus, but to really as a conversation starter.
Sounds important. We have a similar question from Italia. Thank you for that question. I would be curious in how you'd respond to this, Dr. Wolf. It's from Eric. He says, does a technology-driven society where everyone is always on their phone and not talking with their community, is that a factor in mental health issues or mental health cases?
Can be, yes.
Can be, yes.
The issue, the big question that's debated and looked at is, do cell phones and that type communication and internet, even like this program, cause people to be less interactive with each other in person? And so that there's kind of a dynamic there and a little bit of issues with that. But however, it may also help people get more connected with other people outside. So it's kind of a twin-edged sword, and so it depends. Now, if somebody's coming in and saying that they're not interacting with people as much, but they're spending time on video games or texting their friends in a different city or things like that, we'll take a look at that and say, yes, you need to be thinking about changes. Yeah. But I think that to say that there's no phone use or cell phone use on campus would be a revolution that would be unacceptable. And so the point being is that there's an acceptance of yes, this is the way the world is right now. We think there's a lot of good things about it, but also there's some things to take a look at that may be detrimental, as this question leads to.
it looks like you agree with that.
Yeah, absolutely.
Yes, absolutely. All right, so, we've got a wonderful comment. You guys will appreciate this from Monai. She says that she loves the idea that we've partnered with Paul Quinn.
Oh, good.
I think you guys are both eagerly excited about that as well. So we are literally running out of time. If you have any last minute questions, now is a great time to submit them. We have less than 5 minutes left to go. So whatever you've been wanting to ask, put it in now. You know, we have a couple last minute questions from us. And you know, this whole partnership, is there a cost to students? Do they pay to come to the clinic, or is it part of their campus wellness type thing?
The answer is the students do not get charged for services. Mm-hmm. It is free for them. And we're very much interested in them utilizing kind of this free resource. Yeah. And some of them come there and say, "Oh, this is great, this is cool," etc. Yeah. But there, in the partnership, there is there are finances involved with that.
Right.
That again, President Sorrell and the university have handled, and so I think it's great. It's very nice, a nice setup for students for sure.
Yeah. So, Dr. Moore, since you talked about this earlier, and this relates to you, so Italia's another question she has. She said, "Do you think mental health is related to the student's social background?" It sounds like in some cases it could be a factor.
Absolutely. I think that when we know for any college student that's coming to college, as a transition time, that could be challenging and coming from that. Mm-hmm. And then for a lot of these students that come from backgrounds where there might, like we were talking about earlier, might have experienced trauma or like financial difficulties or academic difficulties, that plays a huge role into kind of how am I managing this transition to college. Mm-hmm. So really kind of addressing those parts and kind of being aware of what are those kind of the social issues that might be around.
All right. So any last minute words of wisdom you'd like to share and notes about the partnership that you're most excited about?
Well, if I can, I'm very proud. I went to medical school at UT Southwestern. I've been faculty for 30 years here, and I'm very proud of a lot of things that UT Southwestern has done. Mm-hmm. This would be rated very high up there about something. It makes me feel good that we're doing something in partnership in the community, and that there's a lot of positive feedback, I guess, on both sides of things about what we're doing. It's not easy. It's not easy for both institutions, and it's not easy for the students either. But hopefully, as the program evolves and we get more feedback and kind of tinker a little bit with the program, we're going to be able to fulfill even more of the mission of really helping the students be able to get their needs met and their dreams met.
That's amazing. Yeah. Do you want to add anything?
Dr. Wolf said it wonderfully. I think that this has been just like the collaborative and like each side and of Paul Quinn and UT Southwestern really kind of taking the time to hear each other and so to really best serve these students, I think has been really amazing. It's something I get really excited about.
So we have one more question that I'm going to ask, and then we're going to wrap it up. So this question is from Liza, and she says, any suggestions for a mental health provider on partnering in similar ways regarding mental health outreach and education, not only on college campuses, but in any other environments? Do you guys have any suggestions or words of wisdom? And then just start it.
Be passionate about it. I think is be really passionate about whatever you're doing, and don't be afraid to ask questions and ask for things that you really think should be happening and really want, and then be willing to work really hard for it.
There you go. You want to add anything, Dr.
No, but there are a lot of different organizations and coalitions for advocacy, for government advocacy to government, things like that. And so that, like NAMI, that was mentioned earlier, is very much a big advocate. And so there's information out there. If people are interested in getting involved, we welcome their involvement very much. Yeah.
All right. Well, I think that we're gonna call it a day. Thank you both for joining us. This has been a wonderful discussion. Thank you all for tuning in. So don't forget that this will be visible. You'll be able to watch it on our YouTube channel later this afternoon. That's UT Southwestern Med. And it'll also be on our Facebook. So again, we thank you for joining us and hope that you have a great day. Thank you.
Thank you.
Thank you.